Hip replacement surgery can be life-changing, but the recovery time and the immediate pain takes away from the long-term benefits.
So here to talk about a new form of hip replacement is Dr. Joseph Confliti. He's an ortho trauma surgeon at ETMC. So tell us about this new approach to hip replacement.
The approach has been around actually for some time, but what is different about it is in the past, if we look at the model here, we would go and put in a hip replacement either from the side or from the back, and either route has their complications in terms of dislocation and taking down the muscles off that side of the hip. And so now this new approach that we have utilizes putting in the equipment and the implant from the very front such that we don't have to take down any muscle. And what that allows the patient to do is get up a lot quicker, they have less pain in the early post-operative period, and they just do functionally better.
How'd you come upon this particular approach to hip replacement surgery?
Well, it's like I said, it's been going on for a while, especially in Europe, and a surgeon in California kind of pioneered it here in the States. And what's good about the procedure for our group, which we take care of a lot of the trauma at ETMC, is that this approach we use all the time for patients who have fractures of the head of the femur in this area right here in front. And so we normally do that a lot. And so it's a technique that we do, but we never really put in hip replacement through that approach. And
so by going in through the front, does this mean less invasive? And also, what is that? I know you said it shortens the recovery time, but what kind of a time frame are we looking at now?
Well, typically patients with a regular hip replacement are in the hospital anywhere between 3 and 5 days. What we're finding with this procedure, it can be even 1 day, sometimes 2. They don't have as much pain because when we go through the front here, we're going in between the muscle layers, and therefore the muscles aren't damaged as much. The incision is somewhat smaller, but incision length really is not that much of a key. It's how much damage is incurred in putting in the replacement.
These are getting to become so common now, right?
They're very common, and arthritis is affecting almost 20 million Americans at this point. And so as our population does age, this is going to be even more prevalent.
But we're seeing even younger and younger people, though. I'm in my 50s, and I see a lot of people getting this kind of thing now in the next few years.
That's true, too. And I think as patients are getting older, they're still very, very active. And the key to a successful implant is the longevity of it, because if it can last for 15, 20, 25 years, then it's only one procedure and there's good success, no pain, and good function. So that's kind of the key of introducing this new approach, is that we can decrease the amount of complications early on, but yet have a very good longevity to it.
And with just a few seconds left, particular candidates for this, or do they just need to talk to the doctor? Or?
You really need to talk to the doctor. If the bone quality in the patient is not that good, it's probably not advised, because there are certain maneuvers we do in the operating room to position the patient, but almost fit for pretty much everyone.
All right, Dr. Joseph Confliti with the ETMC. Thanks for being here today.
Thank you.
Appreciate it.
Thanks for coming in. You bet.